slightly faster than mine.
Good afternoon, everyone. This is a meeting. Good afternoon. This is a meeting of the Committee on Administration for the County Board of Dunn County. I'm going to do a roll call. I'm going to start with Supervisor John Calabrese.
Here.
Supervisor Jim Tripp.
Here.
Chairman Dave Bartlett.
Here.
Myself, Vaughn Hedlund. So far missing, we are missing Tim Lenow, who was on vacation, and I'm not sure about Sheila's story. Hopefully she'll be joining us soon. Our first item is approval of the minutes from the July 22nd meeting. Do I have a motion for that, or?
I'll make that motion to
Okay.
approve this.
Supervisor Calabrese so moves.
I'll second that.
Chairman Bartlett seconds. Any questions or corrections on the minutes from that date, July 22nd? Okay, hearing none. All in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Hearing none, passes. Joining us also today is numerous staff members, including our accounting manager, Paul Miller, who's here with us today. Public comments. Do we have any public comments for this meeting?
Not that I'm aware of.
Okay, thank you, Paul. Staff reports. We are privileged to have written staff reports from all our departments that are under the jurisdiction of the admin committee, along with an updated financial report from each of those staff members and areas. Any questions for any of our staff?
Mr. Chair,
Mr. Miller.
if I may prompt Heather Murray, our HR director, in addition to her monthly staff report on activities in HR, she has included in your packet staff reports regarding equity compensation and extension of LTE positions, if there are any questions on those as well.
Okay. Any supervisors have any questions?
Mr. Chair, if I might.
Supervisor Jim Tripp, go ahead.
I'm a little bit confused as to the budget reports. In most cases, the first line of revenues indicates that taxes have not been allocated to specific budgets yet. The remainder for 2021, I'm assuming, is the amount yet to be allocated because that's what was budgeted. Is that correct? Am I reading this chart correctly?
Yes, Supervisor Tripp, that is correct. Basically what happens, historically, we would do a journal entry after the August settlement, the final tax collection report, and we do those late in the year. One of the process changes that will likely take place going forward in future years, we'll start doing that earlier in the year, allocated like we've started doing other things. It's just in this case, building it into the workflow with budget and audit and everything else. We've not caught up to that yet. But yes, you are correct. We will be allocating those out, and they're the only fund that would have any potential for shortfall would be general administration at the end of the day, because that's kind of where any overages or shortfalls. Typically, there's no overages. It's typically if there's any shortfall from lack of collections, but usually they're not significant.
Thank you. I appreciate that. There are a couple of anomalies. One in the financial reporting budget that reports a year-to-date revenue of $297 Did you have some spare change that you put in or what?
Oh, yeah, that was, my.
You did?
Did out.
This is being
I-
recorded, remember that.
I know that. I know.
Okay.
Makes sense. No, it's the accountant in me. I put the change in there. I pulled the actuals up, but those would be for miscellaneous charges. I don't have the specific detail up to give you the detail. I can certainly get that for you if you wish.
No. It just seemed like I'm trying to make sure that I understand all the numbers correctly. And one way to do that is to compare one set of figures with another. And that's the one that was anomalous, as I said. All right. Thank you very much.
You bet.
Okay, just an update. We have been joined by Supervisor Sheila Story. And so
Mr. Chair, I have a question also.
certainly, Chair Bartlett, please go ahead.
It's for Heather. In your report, you talk about the two people that we've had to raise the wages on. When will the Committee on Administration see the classification and compensation study? That should be getting done fairly soon here, right?
Yes, I would say end of September. The September meeting, I believe, is when we are anticipating having the results to submit to Committee Administration.
Okay, so you'll be Keith, do you start putting that in the budget before the Committee on Administration rules on that or not?
Yes, the answer is we're going to have to have sufficient time, and then we'll just have to adjust if there are any changes that come out of the committee meeting.
Okay, I was concerned about that. Okay.
Yeah,
Thank
if I may, Mr. Chair, it is awkward. It's a calendar and program-driven decision. But in the end, as Chairman Bartlett knows, if the committee and ultimately the county board changes anything from what staff has done, we will make that change. It will be the board's budget.
But I guess my question for the two of you is, Keith and Heather, is you'll be able to have the information so that it'll be in the budget, updated part of the budget for executive meeting in September or
Yes.
not?
Yes. Keith and I
Okay.
have been working together. Keith, Paul, and I have been working together to make sure that timeline is met. So.
All right.
So just to reiterate, it is awkward because executive meets before committee on admin.
I know that.
We will present, right, and I know that's where you're coming from in making this point. We will present the most up-to-date information at every committee level in September. We are anticipating that the Committee on Admin will agree with what's in place from the comp class study, but of course, the Committee on Admin may not. But that is what we will present to executive on September 8th, even though Committee on Admin does not meet until September 23rd.
Okay.
Anything else, David?
No, that was it. Thank you.
Thank you. Anyone else?
Chairman, I have a question.
Yes, Mr. Calabrese.
Yeah, just curious, in the county manager's report under number 5, about the house calls employees, are those, is that similar to the home health employees, or I'm just wondering what the house calls employees are?
Stay tuned.
Oh, okay, we don't know yet.
Stay tuned.
All right. And then also I noticed the redistricting comment in that report, and I was going to have a question about it, but then I saw the county clerk's report about the redistricting. And my question is is there a way that we can access that Gantt chart that's a little bit bigger for my aging eyes, because I can't really see it on there?
Andrew?
Yes, Supervisor Calabrese, I'd be happy to share that with you. And I can send that out in an email right now.
Great, thank you so much. Yeah, that's all I had. Thank you.
I wonder if all of the supervisors might be interested in what the preliminary maps look like that Steve and Rachel came up with. That maybe we should send those two items out, the maps and the timeline, to everybody. So I'm sure I know there's interest out there in the county on this.
Yes, Chairman Bartlett, I'd be happy to do that. I can send the Gantt chart as well as the preliminary tentative redistricting maps that Rachel Wells and Steve Kochaver have done. Just so the Committee on Administration is aware, the redistricting committee will meet next week on Tuesday, August 31st at 8 a.m. to adopt the tentative plan. And then from there, the tentative plan will be uploaded onto the Dunn County website for review before the public hearing at the county board meeting on Wednesday, September 15th.
You might want to include, if we're going to distribute soon to the supervisors, a banner to the effect of not official. I mean, even though it says tentative, as we know in the redistricting process, a tentative plan is actually one of the formal plans. So we want to make sure that what we're distributing, people understand this is not official, it is not final, it has not been approved.
Absolutely, Paul. I will make sure to do that. Thank you.
Thank you.
Thank you, Andrew. Anything else? Any other questions, comments? No. Okay, thank you, everyone, for your time. Are we done with staff reports, or do any of the staff have anything that they wish to add or point out about their reports or additional information that weren't able to include? All right, hearing none. Item 6, consideration of actions to be taken by the Committee on Administration. Point A is to approve bid and plan for third-party health administration, approve the renewal of a dental insurance provider, and approve for the year 2022 employer premium contribution rates for health and dental insurance. Heather, are you going to take over that, or Paul?
Heather.
Heather, okay.
I have a presentation because it's a lot of information, but the real question is, am I going to be able to get this to work? Maybe. Already having technical difficulties here. All right.
You're asking about the technology, not the plan, right? Can you see my screen?
You can.
Yes.
Yep.
All right. Now the question is, which one is it on my computer? There we go. So topics that I'm hoping to cover here today include the background information. We've actually been working on some of the health plan items throughout the year, so I want to just kind of touch on that, go over the RFP process, what our recommendation is and what the cost impacts will be, and then move into the dental insurance with the same type of information. And then certainly questions or discussions stop me throughout. So from a background standpoint, taking us all the way back to 2021, if you remember, coming out of that, we had some employees and ourselves, we were a little frustrated with some of the changes and the costs and some of the plan designs that needed to change in order to get the renewal down. Our renewal came in at 20.76. And so we did implement some plan designs. We did implement employee cost share in order to get that final renewal down to just under 8%, 7.69%. So ultimately, at the start of this year, we definitely had a goal to have that look different. And so we've been working throughout the year to move in that direction. Our current plan design has two separate networks. We've talked about the Mayo only network versus the choice passport where people can elect where to go. Currently, that the two plans, we steer employees into the Mayo network, which statistically has shown to be a higher cost organization if people choose to go to Mayo versus other alternatives. We've seen over the years costs to the plan increasing. We've seen a trend of high utilization and a decrease in that fund balance going back to 2016. And so really taking effort or making efforts to change that and shift costs and bring that fund balance back up to where it needs to be. So currently we use Medica as a third-party administrator. We do struggle a little bit with obtaining data from Medica. They're not very transparent, and so it makes planning a little bit difficult because we don't know where those high cost claims are. We don't necessarily get good utilization or prescription cost data from them. And then I believe when this all was started, the expectation was that we were going to have higher Mayo discounts, but when we actually put pen to paper and do some of those calculations, they're not discounts that we had anticipated. And actually Medica came back with a renewal of a cost increase for 2022 when they provided us the renewal rates. Now I will say it was just under 3% for that increase. Our goal really was 0. And so with that, we began to identify ways to reduce costs to both the employees and the county. So long-term goals and background. So back in, I believe it was April or May, the committee endorsed the concept of a near-site clinic and beginning a partnership with a local direct pay clinic called Reform Medicine. The goal with this partnership is to provide an easier and cost-effective means for employees to obtain wellness, acute, and chronic condition care. It's easier to get into these appointments and it's less costly with a near-site clinic. We are looking to reduce some of the higher costs to the plan. Reform is transparent with the utilization data, so we're going to know if people are using it, and we won't know who, but we'll know what services individuals are using to help us plan for the future. It provides employees with a resource to help them find the highest quality, lowest cost option available within our health plan. So essentially, if they go to Reform, they need to be referred out. Reform will be able to work with them. Reform will know what our medical plan is and help employees become consumers of their health care, which we did start some of that messaging at the end of last year. And then it provides an effective healthcare option for our part-time and limited term employees at a reasonable rate. So we can offer this program to individuals that maybe aren't eligible for our health insurance plan, but do want some of those basic tier 1 type plan coverages, and they can purchase that from the county. The next thing that we did talk about and was endorsed by the committee is that health savings account contribution. And we started those discussions really at the end of 2020 in that we do have higher deductible plans and helping the employees maybe offset some of those costs. So beginning in January, we are going to be, the committee endorsed an incentive payment of up to $750 for single, $1,500 for family of contributions into the HSA account. And these are incentive based. And what we've done is tied that over to Reform since the two are rolling out together. It's going to help us get some of those educational pieces out on that near site clinic. So it'll be two steps: attend an informational meeting and attend an appointment at Reform. And you get 50% for the meeting, 50% for the attendance at an appointment. And really important is We will be having spouses involved as well. So if it's a family plan, spouses will need to do those two things as well, because spouses also utilize that plan. Again, with long-term goals, we're looking to relieve some of the potential cost burden on the employee. So we're just looking to provide them with some funds to use towards that deductible and those out-of-pocket expenses. And this also does give us some recruitment strategy in that we are contributing towards those deductibles. So now with some anticipation, we get into the request for proposal and what does this all mean? Again, we had some goals for our renewal. We wanted to have some of those strategies to reduce and or keep costs down to the plan. They're long-term goals. It's not going to happen overnight, but starting strategies now, hopefully we'll see in the future those costs of the plan going down. We wanted to have few to no plan design changes. There was a disruption last year. We wanted a year of status quo. The committee that was a big goal that was set forth. So we definitely put that into our goals. Developing strategies to work with employees and educate them on becoming those smart consumers. Oftentimes the plans can be confusing. What somebody needs from a health perspective can be confusing. And so we really want to make it more of a service and a partnership with employees as well. We wanted to find a third-party administrator to partner with to help us meet those goals that they're gonna be there to help employees. We want the third-party administrator to provide us with information. We want our information to be transparent so that we can make future plans based on accurate information. And then I mentioned this, providing employees assistance in just understanding that plan. So we did receive 7 self-funded proposals and 3 fully funded proposals. I was pleasantly surprised. In my past RFPs, I've never experienced receiving that many proposals. So that was a little exciting. We did do an analysis. Self-funded continues to remain the best option. We ended up interviewing 2 based on their proposals. They met the things that we were looking for from our goals standpoint. So with that, we are recommending Prairie States. And I'm going to get into some of the details around Prairie States and discontinuing the use of Medica. With Prairie States, there are no plan design changes proposed for 2022. So the plan just rolls forward. No changes in deductible, no changes in copays, no changes in out-of-pocket. So the structure of the plan design remains status quo moving into 2022. And then you can see the big 0%. Their proposal came in at a 0% increase to the premiums for 2022. So we were pretty excited about that. There are a lot of advantages as we see it to partnering with Prairie States. There is a single network of providers that includes both Mayo and non-Mayo providers. So we get down to one single network for employees. There's no need to choose between the 2. What that reduces from an administrative standpoint and from a less confusing, for the employees is instead of 8 different plans, because we have 3,000, 6,000, 5,000, 10,000, Mayo, non-Mayo, it ends up being a lot. We're down to just the 2 plans. It's a lot easier to explain to new hires. It's a lot easier to provide information to existing staff. They will provide us with that transparent information. We'll have a portal, be able to access the information in real time. We were excited to learn that they have a team of experts that are dedicated to knowing our plan. So they dig in there and they know all of the details of our plan. So if employees call into them, they can also provide that assistance in either case management or billing. And then they have a claims administration team. So they're auditing for those claims that are coming in twice from a provider, or we're being overcharged, or there's a question as to why something was ordered and is it really necessary. So they have RNs on staff that know what is necessary, and they will push back and appeal those claims on behalf of the county, which will help drive some of those costs down. We're not paying for claims we shouldn't be. Another change that is exciting with this is they partner with a program called Scout RX for prescriptions for pharmacy. So there's many different ways to reduce costs to pharmacy. Scout RX has multiple layers, and so they're going to help find the lowest cost option for employees to obtain their prescription drugs. And the employees in the county will see some of those discounts. We're currently not receiving the rebates. And so this plan will allow us to see those rebates. They also have the ability to partner with the near site clinic. So then this all comes together as to one big program for our employees, and employees will be receiving consistent messaging between the health plan and the near site clinic. They partner with a transparency program called Aletheus. So Aletheus, again, learns our information, and employees can reach out, the near site clinic can reach out, or Prairie States can reach out, and Aletheus will then run where the best option, the best quality option for employees at the lowest cost to the employee and the plan are, and provide that data to employees so they can make a good informed decision. So we're really excited about that. And I just covered that. So Reform Medicine also has access to that. And if an employee is there, they will be able to run that with the employee and look at those options. So I believe this was in the packet. This just highlights that the current contribution rates are 8, 5, and 4, depending on the plan for an employee and what the rates are. That does not change. And the cost of the employees do not change. It got a little bit tricky because of the Mayo only plan. So if employees are on that, they move down. So some of them will actually see a reduction in their employee costing. So those that are currently at that 13% level, they'll move to the 8% level, assuming that they elect to remain on the health plan, and they will see a reduction in their share of the premiums. What does that mean for the county? Well, for those individuals that are on the higher cost plan and they move to, or that are on that higher employee contribution, it'll end up being that the county will contribute a little bit more. But that said, we don't have very many individuals that are on this plan, and what we're offering to employees is definitely a more robust plan with the services that they'll receive. So that was a lot of information. I'll pause here. Are there questions on the health insurance piece? It's exciting information, guys.
I have one question, please. Well,
Go ahead.
am I good?
You're good.
Well, I'm not good, but my sound. The Scout RX, I understand the purpose, but there must be a cost to that. Is that factored into the entire cost of third-party administration, or can we isolate that out?
It won't, it's basically just moving where our pharmacy is over to this, and we're projecting a savings on pharmacy because they've negotiated better rates on highly utilized prescriptions and non-highly utilized. So there's not, it's all built into the cost.
Okay.
But I can certainly research that and see if we can get some alternative data out.
No, I don't think you need to do that. What I was wondering is this a factor of the overall cost of the plan, or is it a separate? And I didn't see anything here.
No.
Okay, thank you.
You're welcome.
I had a question on that Scout RX also. Is that like that you get it over the internet, Or do you still get it from a local pharmacy?
I'm going to use my attorney's response. It depends. So really what ScoutRx does is similar to the health plan. They're going to look at the pharmacy needs, what the prescription is, and they're going to work with the employee to determine the best, to let them know what the lowest cost option is to the employee. So if it's mail order, they'll let them know that. If there's a local pharmacy, they'll let them know which pharmacy. It's very similar to, right now, I'm guessing all of us choose a pharmacy and we just keep going to that same pharmacy. But if you use GoodRx and you plug it into your app on your phone, it may be that your prescription at Walgreens costs $20 more than if you drive across the street to CVS. And it's a very similar program. They just have it built in so that when the prescription comes in, they're able to do that analysis and work with employees, and Prairie States is able to do that too. So I can't say directly, the employee will have to make a decision, but they're going to have all of the information available to make that decision.
So if they don't make the decision on the cheapest one, what happens?
Then they're going to pay the higher rate for that prescription. But they'll know what that cost is up front. So, and the plan, I mean, if it's a higher rate to the plan, then, hopefully we're still getting good rebates on it. But if
So if they pay a higher rate, then you're talking about that going towards their deductible?
Yep, the prescription would be applied the same way that it is with any other pharmacy network. So it's just switching your pharmacy network. So there is a pharmacy plan that's sitting in the background of our current plan. It's utilizing that, and they could be using mail order. They being the employee. And we could have employees doing that research and figuring out what that lowest cost is. This just provides them with more support in figuring that out.
Mr. Chair,
Yeah, go ahead, Supervisor.
I just want to compliment Heather. This is very, very well done, and I can see why you're excited about it. So I just wanted to compliment you on all the work you've done with this. This is really good.
Thank you.
Any other questions or
Mr. Chairman, I have a question.
Supervisor Calabrese, go ahead.
Thank you. Heather, thank you for this. You said at the beginning that Medica had a lack of transparency in some things that you were concerned about with the drug costs, and I think you mentioned something else. And so I'm guessing that was a topic of discussion with Prairie States to get some reassurances that they would be more transparent about those things.
Yes, that was one of the primary discussions in both interviews and when we were reviewing the proposals. It's really important that we know what's happening with the health plan so that, if we decide to put an education program together, we're doing it around the data that our employees are, what they're utilizing the health plan for. So it does us no good to do an education program on smoking if only 3% of our workforce smokes, but we have, 35% that are diabetic. I'm just making stuff up, but so we really need that data, and we need to know where are the cost drivers. If we're doing a bunch of MRIs and they're doing them in Eau Claire, trust me, driving to Woodbury is less expensive. We want to get that communication out to employees, and we want to do it in real time. So we reviewed their, it was screenshots. We didn't log into their system, but we will have a login, and we will also be able to help employees better than we can right now. So if somebody loses their medical card, right, and they have a doctor's appointment, we'll be able to help them in printing a temporary card, not something that we have the ability to do right now. So we really will be able to be better resources for our employees. We'll be able to go and retrieve the data that we're looking for. They'll write ad hoc reports if there's something they don't have in their reports that we want.
Oh, that sounds great. Thank you.
Mm-hmm.
Any other questions?
Well, I'm just I'm a little bit confused or don't follow it quite so good. What, I understand when you say that the drugs are cheaper with Scout RX, or that it's cheaper to go to Woodbury for an MRI. But what drives the employee to want to go to the cheapest place? What's going to drive them to do that?
It's going to vary by employee, but they're out of pocket. So it's still going to hit the deductible. So if you go to Eau Claire, say, and it's a $7,000 MRI and the deductible is $6,000, then their out of pocket is the $6,000 versus if they go to Woodbury and it's $1,500, that's a very different cost. And they'll know that up front. If I go to Sacred Heart, I'm going to get charged X. If I go into Woodbury, it's going to be a different cost. So the reduction in what the cost is out of pocket up front to an employee is what I've seen drive them to making the decisions. Right now, the way things are processed is they know after the fact. So go have your MRI because that's where I was sent, don't know the cost, and then I get a bill. We're trying to help them make that decision. And if they decide, yep, I only want to go into Eau Claire, they can do that. The other thing that did come out of our meetings last year with several employees, and we get phone calls in HR, is that they're looking for this type of strategy. They understand that our plan is getting hit with these higher costs, and we started sharing with them these different scenarios, and they asked, how do we get that information? How do we start shopping for our benefits? And so some of it's education. There are going to be people that it will not change the way that they manage their health care with regard to the health insurance. But there is definitely a population of individuals that are looking to be able to understand it better and not have those out-of-pocket expenses if they can be avoided.
Okay, thank you.
You're welcome.
Mr. Chair,
Go ahead, Supervisor Story.
isn't it also, well, a lot of times I believe what happens is when you go to the doctor and the doctor says you need an MRI, if you go home, all of a sudden you might get a phone call from that specific vendor, maybe it's mail, and it'll say, how are you going to pay for this? So, they're not just going to sign you up for something that large without having some understanding of which insurance is going to pay for it. And I guess what I like about it is the app, it's user friendly. So, you can sit there as a employee or consumer and you can actually go into the app and actually look, and it'll show you what the prices are elsewhere. And if I'm correct, is that right, Heather?
Aletheus is a program that you would work with. So we need to educate our employees to say, just because your doctor says you need something doesn't mean you have to schedule it while you're sitting there. So go home, contact Aletheus, get the data, and then schedule your appointment with whoever you want. And it's making sure that they're aware that you don't have to go to Mayo. Mayo is going to make you think you do, or Marshall's going to make you think you do, but you don't have to. And you can say, no, I want to research the cost, and they can write a prescription. So it's those pieces that people maybe don't necessarily know that we want to build an education program around. So at this point, there isn't an app, but there are the tools and the resources, and then it's us really working with employees to understand that.
Okay. Thank you.
You're welcome.
Okay, any other questions for Heather? Okay, Heather, you can continue with your
Dental.
presentation.
So believe it or not, this is actually the item we'll probably have even more discussion on. We are fully insured through Anthem. There's currently two plans, one that's called a DHMO. It's a higher cost plan. It's got more extensive, essentially orthodontic coverage. There's a few other nuances to it. And then we have what's called a freestanding plan, which has a little bit less being offered in it. And the orthodontics is a little bit less, and I'll get through some of that. We do have a composite rate. So what that means is it doesn't matter what tier of the dental plan you're on, the rate is the same for all. So a single out-of-pocket cost is the same as a family out-of-pocket cost. The county contributes $50 per month, doesn't matter which option individuals elect. So no matter what happens with the plan, design, and the cost of premium, the county is always only paying that $50. We have run into concerns from candidates and a few internal, but it has come up during the hiring process regarding the cost of our dental. We do offer a more robust plan. And so unless an individual realizes and starts digging into it, they really just see kind of the sticker shock of the dental plan. We received our renewal from Anthem, and to keep the plans as they are, it's an 11.5% increase. So needless to say, we went out to RFP. This is a little bit more of what I'm used to. We only received 3 proposals. There was really only one that was competitive. And so we started to pursue it, but then took a step back, looked at who was in network, and given the orthodontics that the employees that currently have the plan, it's very important to them. We did a survey just to make sure that, you know, as we're looking at the dental plans, we understand what employees are looking for. There were no local in-network orthodontists on this plan that we had received from the other competitive bid. So we decided that was probably a problem. People didn't want to drive super far for orthodontics, especially since those are ongoing appointments. So we went back to Anthem and we said 11.5% is an awful lot. What can we do differently? And they provided us with some plan design change options for both plans that actually result in reductions to the rates for both the DHMO, the orthodontic plan is how I refer to it. That one would reduce by 3.23%. And the freestanding plan with the bigger network, actually the rates reduced by about 20%. But in being transparent of what those changes look like, the higher cost orthodontic plan, currently there's no coverage for out-of-network services. The new plan actually provides some coverage up to the 70% rate. The current in-network orthodontics is covered 50% to $695, and then it's 100% coverage, but there's no out-of-network coverage still. So in their new plan for 2022, it would be the $695 is simply a copay. And then it's 100% covered. So it's just a matter of like the time as to which that $695 is paid. And then for out of network, there's a $250, they word it this way. It's 100% covered up to $250. They'll cover $250 of the orthodontic treatment. So the employee cost actually, again, reduces. Currently, this plan is $91.91. I don't remember who was talking about the cents. And for 2022, it goes down to $87.32. So there's some advantages there. The freestanding plan, and this is the more traditional plan, and I'm going to say this is probably more market traditional as well, which is why Anthem is presenting it. Our plans are, again, really robust. We've seen a shift away from that over the years. And so the current plan, stainless steel crowns, porcelain crowns, inlays, onlays, they're all covered at 100%, assuming there's you have to obtain prior authorization. The new plan removes that coverage for those pieces. In-network orthodontics currently is covered 50% to $800 with no out-of-network coverage. There is the design change here is 50% to $1,000. So there's about a $200 gain there for in-network coverage. The employee cost change goes from $63.87 to $40.95. It starts driving us in that direction of really being more market competitive with regard to a dental plan. And then the new plan design also provides a larger network of providers. That is a piece of feedback that we also received, is that, you know, people want a better selection of dentists. So we are recommending the plan design changes that Anthem presented, but we are also recommending that we sunset that DHMO plan effective the end of business December 31st of 2021. It really is an unusual plan. I think we're only one of a few in Anthem. Delta doesn't necessarily even offer that. MetLife doesn't. We've done some research. So it really is an unusual plan design that has started to go away over the years. Our recommended strategy then, if we were to sunset that plan, employees currently enrolled in the plan would be eligible to remain on the plan. So we would keep the plan active with Anthem, but they would have to elect it during open enrollment and continue to elect it. As soon as they drop off of the plan or don't elect the plan, they would not be able to get back onto the plan. New hires would not be offered this option. They would only be offered the traditional plan. And so the goal really is to move towards that more traditional plan and help us with some of the recruitment strategy and the ability to work with the dental insurance companies. When we start talking about that DHMO plan, it really limits our ability to negotiate changes from provider or changes from Anthem to another provider, or even having people bid, because it's just such an unusual plan. It really drives us closer to market. The other piece is that the DHMO plan, as we sunset it, would be reviewed every year. We would review how many people are enrolled, what that utilization looks like, determine if it's still in the county's best interest to keep that plan. So there's no guarantee, but every year it would be reviewed just like we do currently. And then the other recommendation is that we eliminate the current freestanding plan, go with the plan design changes proposed by Anthem, take advantage of the reduced rates, again, start moving the county towards what is more market driven. I hate to say it, but the option from Anthem is an all or nothing. We can't choose one and not the other. So it's basically either we elect what they proposed or we elect the 11.5% increase, which is why we're recommending the Anthem proposal. All right, so really in this context, we are just requesting that you approve the awarding of the health insurance RFP to Prairie States and direct us to begin that transition process. It's going to be pretty intense. We're requesting that a recommendation be presented to the executive committee for inclusion in the fiscal year 2022 budget of the presented changes, and approve the fiscal year 2022 employer contribution rates for health and dental. Questions on the dental or anything as a whole?
Mr. Chair. Mr. Chair. I think you're muted.
Go ahead. I'm
Thank
sorry.
you. What would the 11.5% mean in terms of a monthly premium? What's the change to a monthly?
Can I go backwards? So it would take that 91.91 and increase it by about let's see. Is the finance person chime in? No, okay. So it's 91.91 currently plus the $50. So the premium cost goes up $15.61.
a month.
Mhm.
So since the new plan would not cover crowns, it's a good thing for families that have really good teeth. But if the adults need a crown, they're going to pay $3,000 or out of pocket. Is that what I'm reading? I guess I'm a little concerned. And there's no option. I mean, they can't choose one or the other. They have to choose the new plan if we agree to this.
New hire, well, the sunsetting is not part of the all or nothing. That is our recommendation. So you can certainly direct staff to not sunset the DHMO so that there's two options for people to, or it's not the DHMO, but the new option with the orthodontics still does cover those crowns. It's the more expensive plan. That is not part of the all or nothing. It's nothing. It's those two plans with those plan designs. That's all or nothing. So we could certainly skip sunsetting.
Okay.
Heather, this is Vaughn. So if we go this new plan, I think you just stated that there is no coverage for any type of crown
On the traditional.
on the traditional. Okay.
Yeah. Trying to find that folder.
Heather, is there a cost to the county if we do not sunset the plan we have?
No, it's the same. It's the $50 per enrolled employee. Mhm.
Heather, this is Vaughn again. In looking back at the health insurance cost and the fact there was this, each proposal or each plan, so to speak, includes some obviously increase. Do you have a percentage number that it would increase the county's participation?
On the health plan?
Right, on the health plan. In other words, what is our participation going to go percentage wise? Did you have a number there that I didn't see? Or
The proposal is 0%. So that's both sides. The only plans that there is a potential exposure for a county increase, I probably went back too far, is anybody that's currently enrolled in the male only option. Excuse me, not the male only, the choice option. So the wider network option, which we asked employees to pay a higher percentage on that particular plan. In order to shift to a single plan, those employees are actually going to see a cost reduction as they come down from 13% contribution to 8%, which will shift that cost to the county. There are not a lot of employees that elect that plan. I apologize, I did not do that costing, and I can take a look at how many employees are on that plan, but respective, the overall impact here is, for single on the $3,000 deductible is $49.10 to the county. I do know, for whatever reason, off the top of my head, in one group of employees, there's only 7 total that have elected that higher cost plan. That is not countywide. That is a single employee group that I was doing an analysis for, but it's not a lot of employees.
okay, thank you.
Mhm.
Anyone else? Okay. At this point, I'd entertain a motion for passing the recommendations on to the executive committee from this committee. Would anyone care to make that motion? John Calabrese, okay. Supervisor Calabrese so moves. Is there a second to that? Chairman Bartlett seconds. Any other?
I do have a question. The recommendation is for all 3 of the, or the motion references all three of the recommendations. Is that correct?
That's correct.
Thank you. I would just make one last comment then, and I make this comment every year, so you'd be disappointed if I didn't do it again this year. After this discussion, if there's anybody that still thinks that we do not need single payer healthcare in this country, I would ask them to explain their reasons. Imagine if we had single payer healthcare, what we could have Heather devote her considerable talents to instead of this arcane, opaque, obscure exercise in trying to find a way to finance the healthcare of the employees. End of rant. Thank you.
Thank you, Jim. Anyone else? Okay. Hearing no other comments or questions, all in favor of moving all three recommendations forward to the executive committee, please signify by saying aye.
Aye.
Aye. Anyone opposed? Okay, hearing none, motion passes. Heather, thank you for all your hard work and information. And hopefully we didn't tax you with more than you expected, but I appreciate all your work. Thank you.
Thank you. Not at all. It's a team effort. Great HR team.
Do you have anything else for us in this regard? Or are we fine to move on at this point?
I have. Thank you.
Okay. Recommendations for year 2022's budget administration, Mr. Miller. Here we go. Whoa. There we are.
You're muted, Paul.
Sorry, even the best of us. And me. Okay, try this again. All right, does everybody see this? Yes, no, maybe? Okay. So this is the overall for the Department Administration draft budget fiscal year 22. And want to look into some of the details here. We have used the approach in the past of kind of focusing in where we see the greatest percentage changes to illuminate the key differences in the budgets from 21 to 22. And I'm proposing to do the same thing here. The first thing that comes to mind, I'm going to rely on Keith and Heather and others in the administration department to answer these questions. So the first thing that I see, we're looking at, I believe, revenues at this point. Is that correct? I believe it is.
That's correct.
So the first thing that I note on revenues is a nearly 14% jump in the taxes general property on CJCC. What's that? You've got a note here, the levy neutral transfer of funds from DHS to CJCC. Can we expand on that note any?
Okay, so what that refers to is our position of our program assistant. Currently, she is, it's a 3/4 position or half-time position that is funded with the Family Treatment Court grant. This proposal for 2022, we're looking at a transfer of DHS levy funds to CJCC to cover that program assistance wages. They are under contract with a employer or employment service. It would be a zero net, I guess, equivalent a levy increase, because it's really taking 24,000 or so from human services and moving it to CJCC for that position. And then that position really services all of our division staff and programs, not just the Family Treatment Court program. So I assume that's what that is about, but I don't think I put those numbers in there as far as the general property numbers. Those must be totals.
Yeah. Did everybody follow that? Any questions on that change? And as always, as I go through this, if there are any supervisors who have any questions, please interrupt me. If I pass over something that you'd like some discussion on or some elucidation, please let me know.
Well, could I also speak to the diversion court fees? We typically collect fees on program participants in our programs prior to their discharge. Because of Marcy's law, the order of collection has changed, and now the county is the last on the list as far as collecting fees. So Assistant Corp Counsel recommended that we no longer collect fees. So that's what that reduction in revenue is.
100%. And I will also, for the committee's understanding, I may gloss over something that shows a big percentage change if it isn't tied to a big number. I didn't mean to skip over the 4,000. I appreciate that Sarah pointed out that we needed some explanation on that. We've got 6.5% change on the ICS under Financial Services Local Department. Keith, what's that about?
That would be reflective of step increases, pay increases, essentially for the services that are provided to Department of Human Services.
Okay, is that the same thing here, the 15.4% change on ICS local department as well?
Yes, that's what we charge the Dunn County for staffing, and it was discussed with the NDC committee that with recent hires, recruitment and so on, we had to bring people in at a higher amount, plus we had to increase staffing to keep up with things.
And on payroll, the 8% change in revenues from levy?
Same thing.
Okay, are we still in revenues, or is this, yeah, we're still in revenues, aren't we?
Yes.
Okay.
Yes.
General administration, I always have to get Keith to elucidate a little bit on this one for me because it remains a bit amorphous. But it's what we use. It's a line item we use to balance everything else. Keith, do you have anything to add to help us understand? Used to balance the overall county tax levy.
Right. So we know where we have to land to balance the budget out, revenues and expenditures, at the end of putting all of these budgets together across all cost centers, across all departments, and so on, and the tax levy that's assigned to it. So this number historically has been negative because what happens in the Department of Administration budget, if you go next line down, you've got 3 million in sales and use taxes. Those are not assigned to any particular department. The next line below that, 2.3 million in state shared revenues, same thing. So those offset tax levy maybe in other committee on or Department of Administration cost centers. Plus, if there's enough, it would go into the bigger picture of what needs to be offset or available to offset tax levy and other budgets. So this is what's needed to more or less balance for those big dollars that come into and are recorded in administration, as you have to have a placeholder to put it.
So it's money's to be received, just not received yet.
It's a balancing out or a netting effect for those other bigger monies that come in unassigned to a particular department.
Okay. Snowmobile Association revenue we're showing disappearing.
Yes, we haven't, when I did the deep dive review on those, found that we haven't received money for several years. And Chairman Bartlett, I don't know if you have some insights on that, but I've got a note in there to confirm. But when I look at revenue reports, there hasn't been money received for some time. I had some preliminary conversations with Chase BNS, but Chairman Bartlett, do you have any insights on that?
You're muted, Dave.
All right. I was actually studying a different line when you were talking about this. So
Okay. No,
bring me back up to speed here.
Sure. That snowmobile association revenue. Do you have any history on that? I don't. And the reason I zeroed it out this year, because when I look at SAP actuals going backwards a few years, nothing's been received.
Well,
And
yes, I can bring you up to speed on that. We weren't asking for that money for ever. And then about, I think it was 2 years ago. I don't think it was last summer. I think it was the summer before. I was at a meeting with DNR personnel and found out that we could ask for administration costs on that. And I talked to Dan about that, and he was a little bit hesitant, and maybe he never did it. But we could keep a certain percentage of certain money. Now, I don't know, I don't think we can keep it for bridges, but we keep it for trail maintenance, which counts up to a lot of, a fair amount of money, not, a few thousand probably, not a lot. But the thing is, that department spends a lot of money going after grants and administrating all that money from the state. And that's why we're eligible to be able to get that money. Now, I would guess if we haven't been getting it, it was that our previous conservation person decided not to go after it.
okay, so I will circle back then with Chase and see what we can find there. And I don't believe it's in their budget, the ENS budget, but I'll confirm and we'll have an update for executive on that. But I felt it prudent not to count on that. If I can't see a history of it being in, I didn't think it was prudent to continue to budget an amount that we haven't seen coming in.
Yeah, I totally agree on that. I'd like to go back to the explanation on CJCC. That's what I was studying and thinking about. Sarah mentioned 24,000 on that figure, but it went up considerably more than that. And I actually expected it to go up more, because wasn't there a grant that we didn't get for this next year that we didn't get anymore? So one position was going to have to be funded by the county completely, which had been paid by a grant.
I'd like to get you up to speed here. So this figure here really reflects levy only, so it doesn't reflect the grant. We do have our reentry grant ending this year, but that is a contracted position. It's not a county position. We're not looking to bring that on. They're with the Center for Independent Living, and the Center for Independent Living is going to continue that position with their own organization. So this really reflects benefit changes, and then that halftime program assistant that levy dollars moving from human services over to our account.
Okay, thank you. I expected that position to be a county position, so thank you for that explanation.
You're welcome.
All right, I want to move on unless there's other questions. The next one, Keith, you can fill us in on is
Yes.
here, transfer from the enterprise fund.
Yes, and you may recall from the last couple budget years when we've talked about this one, this was related to that whole question and issue and how the county was handling the NDC debt and how reporting transfers and so on historically that we've adjusted to match more or less what really is required to be done. The original plan, it was over $1 million, so we could not just in 1 year take that hit. It just would have, created chaos with the budget. It just was too much, too aggressive. for this round one, and given the fact that our sales tax revenues have stayed higher than expected, even through the COVID early stages, we've actually done quite well, and we're continuing that way. As well as the fact that our fund balance in the general fund has stayed really healthy, and actually doing quite well. As if you may remember from the audit report, we decided for round one, at least, to more or less end that transfer from NDC over to the general fund. Because if you recall, County Manager Miller has reported that, when we look back over the last 10 years, we've been subsidizing the neighbors of Dunn County to the tune of, I think it's $437,000 annually. That's an average. Some years are higher, some years, like last year, actually broke even on paper. So wanted to see if we're able to make this work as a starting point. So certainly that does need additional review as we pull things together with all the updates with the health insurance and other changes that are to come. That was a starting point. So I wanted to touch base on that a little bit more.
So if I'm capturing it correctly, and of course, Keith and I have talked about this, but if I've captured it correctly, rather than budgeting for revenue that we are unlikely to see, we're proposing at this stage in the budget to show something much closer to reality. We don't expect to see revenue coming from NDC.
Right.
And we're not going to budget for it.
Right. And decision was made 2 budget cycles ago to taper this because of
Phase it out.
the impact. Yeah, phase it out, phase out the reliance on it budgetarily.
Right. And now, of course, bearing in mind the difference between budget and actual. So.
Correct.
So if there are any questions on that, if not, what's the
Is
fund
that
balance
line gonna
like?
go away so it won't be as confusing in the future?
I would hope so. I would hope so. That was the plan. That is the intent, to get rid of that, because it's not, the ending result of the accounting changes that we made starting in fiscal year 2020 is to eliminate this and then have the neighbors of Dunn County operate similarly like the Health and Human Services Fund, that if they have excess at the end of a fiscal year, it's automatically transferred over to the general fund to pay off the amount of investment the county's made in their facilities. And so that would take care of this, but that would be based on actual. I don't recommend at this stage or anytime soon to even budget for that until we start seeing a regular sustained profit coming from the neighbors. Otherwise, you're inflating your budget, not based on actual.
Any other questions on that?
I have one, and that is, do we have an amount here in the budget? I'm looking at this $560,000 and then minus 100% that we are budgeting just in case they need a transfer of funds from the general fund.
This is not budgeting. This is revenue. So what in 2021's budget, we budgeted $560,000 of revenue coming from the neighbors to the general fund.
Okay.
What we're proposing in 22 is don't show anything coming from the neighbors, the enterprise fund, to the general fund, because we haven't been receiving it. Now, as Keith pointed out, some years they have done all right. In 2020, it came out $29,000 in the black, basically. But rather than artificially showing a revenue stream that we know is not very realistic, we're just not showing it for 22 because we've done better than expected with other revenue sources.
Okay, sounds good. Thank you.
Okay. And Keith, do you want to touch on the fund balances applied, the 1.1 to 1.2, the 7.4% increase?
Sure, and that is part of the ongoing review of the audit report. And since this was put together, our audit report came in with our fund balance being even stronger, but it's trying to maintain that target of 35%. of our operating expenditures in the general fund. I was comfortable on the initial projections at 1.2 million. That was before we even got the audit results. So it was a starting point. Knowing this would need additional review as we refine things, I felt confident that we could use that as a starting point based on ending results from last year, where we budgeted to use over 1.1 million, and we actually added to the fund balance. So basically that money stayed there and actually grew, and with some adjustments again with that neighbors of Dunn County, how we're reporting the debt and the due tos between the funds and aligning it with reality of how things are today and actually performing, it freed up money to be available in the general fund, unassigned general fund that's basically available for use.
So
This was a good starting point. It's definitely within or above the 35%.
right. So everybody
And where
understands.
are we going to use this money?
This helps balance. This is part of that this general administration really balances the overall county budget. It's not signed to any one particular department.
So the 1.2 million that from the general fund's fund balance is spread across various parts of the budget for the county.
Right. But at Highway Committee, their recommendation is to take about $1 million out of the fund balance, general fund balance, to pay back, in a sense, what's been taken out of the highway fund balance, or at least to replenish it, because it's way below where it should be. How is that going to affect our fund balance in the end? Are we still going to be 35% or higher, or what?
Thank you for asking that, because yes, here's the point in time. This was developed before that recommendation, but I've done subsequent review and went over that with County Manager Miller, and it does appear that still works, and it still keeps us at or above 35%.
Right. We anticipate
All right.
being able to make that donation to the highway funds fund balance and still maintain 35% or above for the general fund balance. Other questions? Okay, moving on. Under IT taxes, Dan, I assume that the drop here is because of turnover? Less salaries and benefits needed?
Yeah, it's because I'm cheap. So yes, that's where that drop is.
Okay. In case some people on the committee have not heard, Craig Sakich, who was the head of our kind of the hardware end of the IT division, turned in his 2 weeks notice. So after 22 years, he'll be leaving us because he wants to stay high and dry for the rest of his life. So he's moving to Florida.
Wow.
Yeah. Wow. Okay. Again, I'm just trying to focus in. Land information has quite a jump in the levy identified. Is that all salaries and benefits as well, Dan?
Well, yes, that is all salaries and benefits, but that is a number that is going to be corrected in a later round. It has to do with some balancing between the grants, the land modernization grants, and the salaries. So what you're seeing there is a higher allocation towards the levy versus the grant, and that will be adjusted down. My projections right now are going to put that at about a 6% increase, which would put you more in line with just seeing that.
What everybody else is seeing as a result of salary and benefit changes. Yeah.
Correct. Yep.
Go ahead.
Before you leave, go back up a little bit to that new cost center that's called IT internal.
Oh, right here.
Yes.
Yes, I wanted to
Shouldn't
make
that be 100% over there.
Yeah, the formula, and I didn't put the formula. Guys,
Hard to find good help.
yeah, I know. I wanted to point this out. Dan, please chime in too if you have additional thoughts on this. But if you recall, last year we started more or less phase 2 of allocating all technology costs out to the departments instead of borrowing when you have to IT equipment. And that's been a conversation point the last couple budget years. Well, why are we having to borrow? And the phase 2, phase 1 was, I think for budget year 19, we started charging out licenses and maintenance fees and things like that, telephones to the department's budgets instead of having it all in IT. This is step 2 or phase 2, where now we're allocating out replacement of computers and things like that on whatever basis. If we figure it's a 5-year asset, IT has a spreadsheet and works with the departments to go through that, and they charge that out now. We started that in the 21 budget. For 22, we have the first items to be replaced using that pot of money. And that's what this represents on the revenue side. We created a new cost center to track all of this money coming in and money going out to replace equipment. So it's hopefully over time going to build enough of a fund that in 4 or 5 years from now, when we have to replace all these laptops that we purchased with routes to recovery or things like that, we've accumulated hopefully sufficient funds to be able to do that. It won't work for maybe necessarily all the big things like servers, things like that, but for the more routine things, it'll allow us to hopefully stay away from having to borrow for computers. So it's an incremental change, but I felt it was noteworthy for the committee here, as you will see that in the expenditure side, some of these allocated costs.
But I ask a question on that fund. Is that like in restricted fund balance?
It'll be assigned fund balance, but yes, yes, it would be in essence county board assigned, and that would be through the carry forward process. So at the end of 2021, IT will make a request as part of their carry forwards, the unused money, and there would be none for 2021. This was the first year that they're charging departments. Then that'll carry forward, and what that does is that's a county board assignment to that money then to be used only for that purpose. Now the county board can reverse that decision if they choose when they act on the carry forward resolution, but that is the intent, to build a structure and a process to have those funds dedicated for that use.
No, what I meant was when all the departments are putting some money into this fund. Is that a restricted fund, or is it in the general fund made up of the 35% that we want to stay at? Or is that in a restricted part and not part of the 35%?
It's, to use your terminology, it is in a restricted part, not subject to that 35%. It would be separate and distinct from that.
Thank you.
You bet.
Other questions on that? Very quickly, Dan, are we expecting a big jump in revenue on addressing fire numbers?
No, it's just to better reflect reality. If you go through historically, that's really closer to the amount we actually typically bring in for those. And there will be a corresponding expense because we typically, well, as we charge for more fire numbers, we buy more signs to put up. So
what you're saying is that numbers have proven hotter than we've budgeted.
yeah, and it's a pass through. So I mean, we would have a greater revenue and a greater expense over time, but it just didn't really reflect reality.
I enjoy lobbing the occasional bomb over the bow. Okay. Land records modernization has taken an 11% jump. What's that about?
That is a fun account. So a lot of the money there, that particular account is the retained fees that we receive. So that's the revenue through retained fees, which also is earmarked money that is only to be used for certain purposes. So that is reflective of carryover funds of previous years and all of that. The increase to the revenue is also directly aligned to a an assumed increase to the cost of our GCS software, the software that we use for the taxing and in storing of all of those records. So and that's where you see those numbers in the comments there. Those are increases from last year.
Thank you. So that brings us to the bottom line on revenues. Any questions from anybody else before we jump into the expenses? If not, when we do begin looking at expenses, the top of each of the divisions is going to be salaries and benefits. We've talked a lot about those. We know that there have been and will be changes from what was presented on the 28th. This is the numbers, what was presented on the 28th. We're looking at the same set as every other standing committee. So I won't spend a lot of time on that unless there are questions. And I won't zero in necessarily on little numbers like the telephone annual maintenance drop of 13%, but it's dollar-wise minuscule. Ditto the internet access. Subscriptions is not something I'm too excited about. Recruitment, HR, we are showing a noticeable jump there. Heather, do we have you say for duty exams?
Yeah, so we're starting to see a little bit of an increase in the number of recruitments that we are doing for the sheriff's office, and they have these fitness for duty exams, and then there's also pre-employment testing, and so those are they're a cost, and it's not something that traditionally has been budgeted at the volume that we're currently seeing. So I just wanted to be practical.
Is it a consequence of a lot of turnover at the sheriff's office?
Well, I don't like the word turnover. I mean, we are seeing retirements. Yeah, I mean, it is turnover. It is individuals leaving, but we're seeing some retirements.
They're leaving.
And then the jail also. I mean, we do see turnover in the jail, and we've seen some increase there. So.
Okay, thank you.
Mm-hmm.
There's a very long explanation here on property insurance under risk management, jump of 12%. Hopefully in your preparations as committee members, you did get an opportunity to review this. I think because the explanations are so lengthy, I'll rely on them unless there are any questions from any committee members on these items. The property and liability insurance changes. If not, I'll move on. We're dropping boiler insurance because we combined it with property insurance. So that explains that 100% drop. We've got a 33% increase in employee bonds. Again, we have some pretty thorough explanations from Patty Isaacson on some of these things. And I don't presume, Heather, I assume it was Patty. Maybe it was you as well. Patty, okay. Well, you think Patty. Any questions on these, please speak up. Otherwise, I will move on. We get into CJCC. Again, you've got your salaries and benefits. Those are set by HR, and they are subject to change as our comp classes coming in. Some changes in the maintenance contract is not really significant, even though the percentage is quite large. Dropping off the separate telephone cost because it's modeled into IT. Internet, again, is very nominal. Let me see here. Office supplies, they're going to do without $500 worth of staples. So we applaud Sarah and her team for that. I'm just looking here to see. Sarah has provided an explanation in the margin on the change in travel lodging. We hope that we'll be able to travel in 22 with COVID coming and going the way that it's going, coming back. I don't know, but perhaps it's prudent to budget for travel and the optimistic hope that we'll be able to do so in 22. We've got a little bit of drop of in program-related travel by virtue of virtual interactions. IT equipment is a substantial job, but again, those cost allocations come from IT, not from CJCC in this case. I'm going to keep moving forward here. Then we get into financial reporting. These are, again, the salaries and benefits. And then we get into, let's see, a big number there, but it's a small number in dollars on telephone. Ditto internet access. The cost allocation from IT, which will vary from year to year depending on the life and the expected life on the various pieces of equipment. Financial services, we again have salaries and benefits laid out here. In lieu of fringe, under financial services NDC, I see a big, I guess that's going away. Maybe that's just a single individual that we dropped off of that. Does,
Correct. That's adjustments with the turnover that we've had in the
thank
office.
you. Thank you. So again, these are salaries and benefits. And then we have financial public works. Salaries and benefits. Very little in the way of changes. We get into payrolls, salaries and benefits again. Nothing very substantial to talk about in any of that. The county manager, that health insurance is not being driven by anything that I'm doing. Believe me, I'm just as falling apart as I ever was, so there's no change. IT maintenance cost adjustments as usual. IT equipment, I got a new computer, desk computer at the beginning of the year this year, so that may account for some of that. And then we get into IT, again, salaries and benefits in this section. Rather nominal changes despite big percentages in terms of actual raw numbers. Internet access is why are we discontinuing MiFi and who is MiFi?
So those are MiFi for IT staff, and the essentially the ability to use their phones is now part of the plan. So it used to be there was a phone and a MiFi. Now they can use their phone as their supplemental Wi-Fi. So that's where those costs came in.
Hopefully MiFi can join on as a cast in a different show since they've been discontinued.
Right, and it just in case you see it, as you look to the cell phones, you'll see a significant decrease in this particular cell phone one, but you will see those changes reflected in the other IT budgets, and that was just a matter of capturing where the actual cell phones are as opposed to putting them all in one specific budget. So
thank you. Job-related education, you're not proposing anything for 22, Dan?
there is you'll see the conferences and seminars
Okay,
is kind of a change.
same thing.
Yep.
Okay, thank you. And we got the infrastructure. That's where Craig Sakich was, where he's leaving us. What's the 25% reduction in the cost on the wide area network?
It's a number that's a little bit closer to reality. Just as we look through the historical cost for that particular item, it is gone down.
And I hope committee members appreciate that our managers are paying attention when we ask them not to simply take the number from last year's budget and plug it into this year's, but actually take a look at what has historically been the case. And we have seen across these budgets as we've been going through them this year for this practice for 22, that in many cases, there have been adjustments based on actuals 3 or 5 year averages. So I appreciate the diligence being shown by our managers on that. IT operations service, that's Luann Domes and her people. Nothing particularly. Office supplies are coming down. I would assume that Post-it notes, actual physical Post-it notes aren't as important when you're an IT person because you have virtual ones, right?
That is correct.
Okay. Do you want to, on internal operations, this $36,500 IT equipment, you want to explain that?
Yeah.
That's the other version of what we just did, isn't it?
That is exactly what that is. Yep.
Right.
So that is where we would be buying the replacement computers.
Right. So this ties into what we were talking about, what Keith was talking about earlier. Okay. Land information, salaries and benefits. We've got a jump in the maintenance contract of almost 23.5%, but there's a note here, fund balance applied on the modernization. Anything to add to that, Dan?
Yeah, that's that increase to the GCS software that I had mentioned before.
Okay. An 87% increase on contractual consulting services.
So I feel like I could spend a really long time trying to explain this one. That particular number is the retained fees number. So that's the expenses that would go towards paying for items related to the land modernization plan. And so that would include the projected revenue for retained fees and the carry forward that we would expect there. We budget that full amount to demonstrate the I guess, Keith, if you can help me here, maybe to balance that out in the end. So there isn't, we do have plans as part of the land modernization plan of things to do. That number is a larger number than I think we truly expect to expend, but then it would be carried forward in the following year, because that piece of that money is earmarked and is not allowed to go back to the general fund and can only be used for the purposes of the land modernization plan.
Putting it in a different way is we're following statutory requirements for the funds, and this is where the funds are being used. We budget the funding coming in, the revenue coming in, and then the approach this year was to budget the expenditures, because if a project does come along that they can utilize it, then they've got matching expenditures to go along with it. If they don't use them under Wisconsin statutes, then they have to carry it forward or use it only for the purposes that those are generated for. So it was just a different approach this year to recognize that we could spend up to that amount if we had eligible projects.
Right. And I think over time, we'll see that number really fluctuate from year to year, whether there's a large project or not. We have a large photo project that's coming in this year that actually will buy down that balance a little bit, but then you might see that climb up again in future years.
Any questions on that? If not, I think we're seeing the flip side on the addressing expenses that we talked about on the revenues earlier. And that is the end, I think, on the expenses before we get into grants. And the grants are mostly CJCC. Is there any particular highlights, Sarah, on the grants on your budgeting for 22?
Sure, we do have some round two changes in store. The one of our grants, the TAD grant, just became available. So we will be asking for more dollars. So we're not a whole lot more, but right now it's just about $100,000. So that's for a treatment opportunity program. The other grant is the reentry grant, and that is coming to a full end at the end of this year. So that's why you see a lot of zeros on the grants for the reentry portion.
And anything in particular on the expense side?
No real changes. It really comes down to majority is staff, and then drug testing, and then some training dollars for the pretrial area.
And we've got notes, for instance, the 75,000 that was in the 21 budget for service contracts tied to the jail community reentry grant, that grant is ending, which means zero. So there's the big change there. So hopefully most of these are self-explanatory. We've got some IT grants, but it doesn't look like anything. Go ahead.
Yeah, well, and so that was, we had talked about it a little bit in the revenue, how that revenue for that land information area was high. If you look at, there's a negative 89% that is showing in the attendance hours right there. So that's where you'll see kind of where there's an issue related to the balance of the salaries for those people. That particular grant also, I think it's that grant, we did get an additional $10,000 this year for that. Those two grants that you see we will spend 100% of those on salary and fringe for our land information people. So that additional $10,000 is a $10,000 savings from the levy as it relates to those salaries.
Thank you. And then nothing.
There's no new requests here. This would be the last page, which shows if the Department of Administration had some capital projects. You look back at 2021, we had 265,000 in IT equipment purchases, and that was funded by long-term debt. So this goes back to the conversation we had last year about setting up a process to hopefully avoid use of debt for buying routine technology.
So that is administration budget. Any other remaining questions from anybody? Okay, I wanted to back up here, looking at your agenda, Chairman Hedlund. I don't know how you want to, if you want to take each of these in turn and make a recommendation on them. Because of course, Corporation Counsel, County Clerk, County Treasurer, these are all different departments. So this was admin. I'll leave it to your discretion how you want to address this.
Okay, let's, at this point, let's make a motion has been presented in terms of admin, and then we can move on in case we have any questions or adjustments on the others. Anyone that can make a motion, we move forward. Now, do we just, this is again a presentation to the executive committee.
This is the recommendation from the Committee on Administration on the budget for administration fiscal year 22.
Right.
Yeah, I so move.
Okay.
Second.
And second from Supervisor Story. Any other comments or questions? Hearing none, all in favor of moving this forward, please signify by saying aye.
Aye.
Any opposed? Okay, fine. Number two then is corporate counsel's budget. Again, we can wait till the end unless someone wishes not, but I guess I would say we would, again, maybe we can wait to the end and then approve the balance of these. Starting out with corp counsel's budget.
Okay. I can call that one up here as well. Now let me go here and share my screen. So that everybody can see that?
Yep.
Okay. Is Nick still with us or did he not?
No, I'm here.
Oh, good.
Yeah.
We should maybe start with the chart, organization chart, because it's changing.
We do have the organization chart here. Let me see if I can find it.
Or maybe Nick just wants to talk about it, but I think we should know that going forward.
Nope, it'll be the other one, Paul. It says proposed.
Okay. I'm going to stop my share because it's too confusing trying to keep track of what I'm doing here.
Yeah,
Hold
right
on.
underneath the one that you just clicked on, proposed org chart.
There it is. You know, it would be easier if my computer would stop suggesting how I might do things and just let me do it. Okay, I've got that now. Share my screen. Okay. Everybody see that?
Yes. And
Excellent.
maybe Nick could explain why he wants to add another assistant corporation counsel.
Yeah. Well, it's a difficult thing for me to ask for because I realize the economic realities of increasing, and also that an attorney is, one of the higher paid employees in the county. For a number of years, I guess I felt for a number of years that an additional attorney in the corporation counsel office would enable our office to provide really responsive, top-notch legal services to the county. The truth is we're able to do a really good job right now. It's just that some things we're always triaging, and some things it takes a while for some things to get back to the top of the pile again, because in terms of priority, because of all the interesting daily things that pop up. And so I've mentioned, probably to the point of sounding a little whiny, to be honest, that I'm busy. Generally, if people ask me how's it going, I say I'm busy. And one of the things that the county manager directed me to do, because his philosophy is, if you want to add a position, even if you know that it may not be likely to be approved, you should ask for it. You should tell the county board, the elected officials who run the government, that you need help, or that you're asking for help. And so I promised I would. This year, I promised I would. I brought it up in the past. Previous county board chair always told me, don't ask because it's not going to get approved. So this year I've asked. The truth is, I think it would be beneficial for the county to have another attorney, but I'll also concede that, we have been doing, at least in my opinion, a very good job. It's just that some of the projects that we would like to spend more time on, we don't get to. There's really been a great increase in attendance on committees because of sometimes it seems like never-ending ordinance projects and new activities that are really more administrative in nature and not really practicing law, or providing legal services. And so my thought is another attorney would enable the corporation counsel department to provide extremely good responsive legal services to the county board. And like I said, having said that, I think we're doing a good job now, and I'm not ready to ask you to cut it right now, but I would certainly understand if you entertain that thought. And the truth is, we're doing okay, and we do a good job. We just have to triage a lot of stuff. And so when things come in, we have to deal with them right away. And what I find is, on a pretty much a daily basis, that I have to set stuff down to work on something new. And then I have to set that down to work on something new. And then I have to set that down to work on something new. And what happens after 2 weeks, I'm finally starting to get back to that first thing. And then it'll start over again. And so that's really the basis for it. I don't know if you have any questions, you can ask me, and I'll do my best to answer them.
Mr. Chair, if I may add to what Nick has said, my perspective on this request for additional help in the Corporation's Counsel office is predicated on the fact that it is an office that provides services to every other element of the county, just as human resources does, just as finance does, just as IT does. And if we don't have enough personnel in an office that provides services, those services get delayed when Nick and Barb, who I agree do excellent work and provide excellent service, are so busy that they can only address emergencies. They never have time to address the causes of the emergencies. So some of these things simply persist. If you're busy beating out the brush fire in front of you, you don't have time to address what's causing the fires in the first place, or the forest fire that's building behind you. So it was on this notion, and many of you have expressed to me and to other staff that it seems that Nick and his team are very busy all of the time. That's the perspective that I came from in asking Nick to put together this personnel request.
And I guess I'd like to add, because Nick didn't say it, but I know he's worked Sundays. I know he's worked evenings. He's correct. They do a very good job, but the hours that Nick puts in to make that office do a very good job for us is probably more than maybe we should expect.
I've tried to put a better balance in work and outside life, but it's true. I have many 70, 75-hour weeks doing this job, and it wears on you after a little bit.
I have a question, and I don't know if it makes any sense, but Nick, probably this is more to you. Is there any thought to, and any possibility of, say, a corporate counsel that we could in fact share a position with a neighboring county? I mean, or do you feel that right now, when I hear you 75 hours a week, you're almost working the second person's position anyway? So maybe, that's a foolish question, but
I don't know that that's possible. I mean, one of the possibilities, I guess, has slipped past us now. At one time I'd mentioned the possibility of having the new child support director be an attorney, and then he or she could do the lion's share of the work for the child support agency, and it would free up assistant corporation counsel to do more legal work that's not child support related. Otherwise, I can't imagine anything. I mean, there are some alternatives. For example, in my request, I submitted a proposal that it be a 1-year limited term in order to evaluate the efficacy of it, whether or not the goals that we want to achieve with it are achieved, in fact. So it would be designed to, going into it, it would be a 1-year term and not anticipated to be extended beyond that. I think it's possible that could be a very effective way of approaching it, because if we were able to get some of the things that take longer to get to the top of the pile in terms of priority, if we're able to get those things wrapped up, the pile, I would expect, will be shorter, smaller, and move faster. And at that point in time, it could be reevaluated as to whether or not we need to have a permanent second assistant corporation counsel position or not. But as far as sharing with another county, I'm not really, I guess I've never, I imagine we could have some kind of a cooperative agreement on it, but I haven't seen it done anywhere. And so I don't know. I don't know if that would work or not.
Okay, thanks, Nick.
Yep.
Anyone else?
And I would say another possibility would be, half time or 60% or something. It would have an impact on recruitment.
Yeah, that would be my biggest concern,
Yeah.
frankly, about either a part-time position or even a one-year term, is recruitment, which is getting more difficult due to the shortage of breathing bodies across all fields. And we are much likely to be successful in recruitment if we have a position that's a position as opposed to a position that may not exist after a year.
I think I think that this conversation has gone on a long time, so I just want to add that as Mr. Miller stated, if you go to PR&D committee, you find out that Corporation Counsel is very busy with that committee, very busy with facilities. And as Nick has stated, the hours he's putting in some weeks, and then when you count being behind, I'm not questioning that we need another person. I think Nick is being humble and kind of almost trying to talk us out of it, but I feel we should move on with this position being in there. I just wanted to draw people's attention to the fact that we were adding a position. So I think we should move on to the budget. Thank you.
Thanks, Dave. Okay.
Let me stop my share for a moment because again, it just gets too crowded to make sense of what I'm looking at here. All right. Okay, let me try this again now. Can everybody see this?
I can.
Excellent. Okay, so there's the summary, revenues, expenses, corporation counsel. There's the new position request. Should we talk about that some more? No? Okay. Under state grants, not a big change there. Actually, not a big change in revenues other than what would be needed out of levy for the new position. The rest of this stuff is the big 44% again is that same position change. No real change in the filing fees.
Yes, that 26.61% increase there. I actually removed something from the budget because I misunderstood the explanation given to me from IT about how it was going to be funded. And so I had to add it back in. And so 2 years ago it was in there. This year it was, or last year it was in there. This year it's not. And now I'm adding it back in for next year.
Okay.
And so if I had actually understood what I was doing, that would be probably about a 3 or 4% increase.
And we see the adjustment down here on IT equipment as well. And that's it. That's the highlights of the entire budget.
Right.
Any questions from anybody on the Corporation Council budget? If not, Mr. Chair, you may want to entertain a motion on this one.
Okay. Anyone care to move forward with this Corp Council's budget, pass it on to executive?
Mr. Chair,
Supervisor Jim Tripp.
I would move that we recommend the budget from Corp Council to the Executive Committee.
Thank you, Mr. Tripp. Second, but
I'll second that.
seconded by Chairman Bartlett. Any other comments or questions?
I would just like to make one more comment if I can. And
Go ahead.
that is that I appreciate County Manager Miller's urging and Corporation Council's inclusion of the position in spite of the fact that it may have a difficult time getting through. We just went through a similar situation with the medical examiner, and we let the situation go long enough so that it became an emergency. Even if this new position is removed in executive, it brings awareness from the whole executive committee to the fact that we really do need some help in your office, Nick. And for that reason alone, it's, I think, worth pursuing.
Any other comments? Okay, not all in favor, say aye.
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 Any opposed? Fine, we'll move that budget forward. Thank you, Nick. County Clerk.
And I can share a screen on that one. And there we go. County Clerk budget. The overview, the summary, revenue and expenses. And then the details. Okay. A 5.4% increase in levy. Is that mostly to offset salary and benefit changes, Andrew? Andrew, are you with us?
Yep. Can you hear me?
Okay.
Okay.
Yes.
Yes, that is correct. That is the mild increase to offset changes from HR based on salary and benefits.
And what's this reduction in legislative support, 32%?
So if you see farther down, so one of the reduction has been the roll call system has been shifted from our office to IT's budget line. So that's the reduction there.
Okay.
Mhm.
And then we have a 66% increase in taxes for the elections. Are we expecting a big election or something?
We're expecting a couple. We'll go from a change of this year. We're having 2 elections in 2021 to 4 elections, a primary and a spring election, and then a primary and a fall gubernatorial election. So that is the change based on those 4 elections.
I'm going to bring up something here that I don't even know if it's really on your radar, but there is the possibility that the county may want to put a referendum in the fall as well on one or more issues. Does any of our elections, does your election budget reflect any of those costs?
It does not.
Your predecessor indicated that, I think the last time I talked with Julie Wothke indicated that a cost for a local referendum was something on the order of $8,000.
That's correct.
We may want to strategize in advance of executive with CFO Keith Stray and myself to bump this up in anticipation of at least one referendum, perhaps coming from the county in 22.
I think that would be an excellent idea, especially based on the conversations that have happened thus far about potential budget issues. I think that would be a good idea.
Yeah, and specifically, I am referring for the committee's purposes at the Neighbors Committee. At their budget review, discussion was held about going to referendum to ask for financial support levy for a period of 5 years to help support operations. We had such a referendum in the past that was successful, which doesn't say it'll be successful again, but it is possible that we end up doing that.
Yep.
Any questions or comments on that?
Mr. Chair, if I might,
Go ahead, Jim.
When it comes crunch time, we very often in executive committee argue about as little as a few hundred or a few $1,000s. Budgeting for an election that might take place might make good sense if we had the money. But I would suggest that if the budget is really tight, we wait to see if that referendum is actually going to take place. And if it is, we make sure that we have the money in contingency. I know I'm contradicting what I've said in the past about the use of contingency funds, but just looking back on past discussions in executive committee, and we literally have spent 20 minutes to a half an hour arguing about as little as $1,200. If there's an opportunity to avoid that, I would like to take that opportunity. Thank you.
If I may, Mr. Chair, Supervisor Tripp, actually, you're not contradicting yourself to suggest that perhaps that a referendum could be accommodated in contingency, because as you'll recall, contingency is, the policy is for two reasons. One is an emergency. The other is a time-sensitive opportunity, which certainly a referendum would qualify.
Well, I don't think it's an emergency if you know it's coming.
It's a time-sensitive opportunity.
Yeah, that we should plan for.
There you go.
I'm going to take one more opportunity to remind you that the governor and the legislature passed a $3.5 billion tax cut.
Yeah.
I agree with Supervisor Tripp that I'd rather not put it in the budget and take it out of contingency if we need that.
Appreciate that feedback. We will certainly take that into account for executive.
Okay.
Anything else on the revenue side of the county clerk's budget?
Nope.
If not, on the expenses side, got stuff, adjustments from IT that are typical. Looks like we're not expecting quite as much printing to go on, but it's only a couple $100, so no big deal there. Computer equipment, we've already, again, we have a general notion on that. Printing and duplication, it's the elections. That's what's driving those big numbers there.
Correct.
So we'll discuss that as well.
Yep.
Anything else? Any other questions on the expense side for the county clerk's budget? If not, Mr. Chair, you may want to consider entertaining a motion to forward this one.
Would so like to do so. I myself would be glad to make a motion to move forward and accept the proposed budget from the county clerk. Is there a second to that?
I would second.
Okay, seconded by Sheila Story. Thank you, Story. Any other questions or comments? Hearing none, all in favor, please say aye.
Aye.
All right.
Any opposed? Motion passes. We'll go forward with the county clerk
Thank you.
budget. County treasurer would be our next in line.
Okay, I think I have that one ready to go. Okay. Again, we start with the summary of revenues and expenditures, and then get into the details. On the revenue side of things, Sophia, is there anything in particular on the revenues that you feel you should highlight for the committee?
The only thing that I would say is the $1,300 that's listed was accurate at the time. So that's ag conversion. And that's really dependent upon assessors going out to towns, villages, things like that, and doing a ag conversion. So at this point, I just looked at my budget and we actually have $6,000 that we brought in, but it's really hard to estimate what we'll bring in for next year. But just so you know that it generally brings in more than I originally listed. And just noting that the last two lines of the 11,000 and the 100,000, there's a line on the, there's a note on the memo line just stating that currently rates are really low, which is why you see a slight decrease in both of them.
Okay. Any questions on the revenue side for the county treasurer's fiscal year 22 draft budget? If not, moving on to the expenditures, again, salaries and benefits. Same boat as everybody else. Maintenance contracts, the big jump, 52% there. Sophia, do you want to?
Yep. So GCS is the software that we use to accept taxes. Zoning and land information also use that. So it's a cost that we all share. And Dan can speak to this more in depth. So GCS was recently bought out by a company, and they are increasing their cost exponentially. So I don't know that we have an actual amount, but the last amount I was given would be the annual cost would be $27,650 that the three departments would share. So that's why. So if we continue with GCS, it is a large increase.
And the 26.5% change on the illegal uncollectible.
And that, again, it just depends on how the tax year goes. And
that's a fairly specific number. I'm just wondering what drove 11,384.
I can't answer that. I can definitely look into it, but I can't answer it right now.
I didn't know if it was based on a 3-year average and we were just being very precise or what.
Nope, but I can take a look. I actually have my notes right here.
Okay. Are there any questions from anybody on the committee with respect to the treasurer's expense side of the fiscal year 22 draft budget? If not, Mr. Chair, back to you.
Okay, thank you. Hearing no questions, anyone like to recommend that we would move forward with the county treasurer's budget?
Mr. Chair, I would recommend that we move forward with the county treasurer's budget.
Okay, motion made by Supervisor Story.
I'll second that.
Seconded by Chairman Bartlett. Any other questions? Seeing none, all in favor, signify by saying aye, please. Aye.
Aye.
Any opposed? Okay, fine, we'll pass on the county treasurer's budget. Debt service is our next item. Mr. Stray, could you help us with that?
Yes, thank you, Mr. Chair. As soon as Paul brings that schedule up. And while he's doing that, really, this is the separate fund that's required under the bonding requirements to have a separate debt service fund to record principal and interest payments. And it's part of the bond covenants that we have these established. So, and really all this is to record the revenue sources, which for all of these is tax levy. When you authorize the sale of these bonds to get the tax preferred rates as tax exempt bonds, you make a commitment as a county board to levy the necessary property taxes to pay these bonds. That gets you a preferred rating in the market. So all of these are the required tax levy for paying the bonds for 2022. I won't go through them individually, but if you have questions, I did put notes in there like for 2013A, 2018 bank loan, as well as the very first one, the NDC initial construction notes. All three of those have been refinanced. The final payments on the 2012, the neighbors bonds will be in 2022. It was an advance refinancing. So the refinancing that we did to lock in the rates, put that money into an escrow account. In spring of next year, those will be paid off. So you won't see those in the 2023 budget because that 2012 bonds will be replaced with the refinancing bonds from 2020. So that's the revenue side. Then if you go down to expenditures, it's really just recording the principal and interest payments.
Notice a big change on interest expense, 51%.
Correct. Yeah, that's the drop due to the refinancing.
That's significant.
Yeah, it is. Well, but it's being replaced in the 2020 bonds. If you look down 2020, you're going to have an increase because those will be the first payments. But the net impact will be a savings to the county.
Exactly.
The only other thing is you'll see third-party administrative fees. In all of these cases, we have what's called an escrow agent. And that is to deal with reporting and things like that, required elements of what we're required to report. And that's paying for those fees. And that's all that's in there. Yeah, let's see here. Can you scroll down one more page? Okay, now the 2018 bank loan, again, you can see where they're paid off. When you look at the 2021A GO bonds, I've got estimated principal and interest because again, when I put these together in May and June, we didn't know. We knew we were going to be refinancing. You had authorized that as a county board, but we didn't have the final rates. Now that we've sold those bonds and actually closed on them today, I will have updates to include in round two. The cost for these, the interest side will go down because if you remember, we had awesome rates at a little over 0.5% on those bonds. So that will decrease that sum. So there'll be a net reduction in the round two presentation. So that's all I have on this debt service. Open it for any questions.
Okay, any questions by any of the supervisors?
I have a question.
Chairman Bartlett?
On the community services bid, bond, whatever, are we not paying anything on that in 22?
No, that was refinanced.
So,
Which one are you talking about? I'm sorry, I want to make sure we're talking the same thing.
well, under revenue, it totals up to about a million. Or actually it's 1,000,080. And then under expenses, I think it totaled up to about the same.
180,000.
Yep.
No, I see what you're doing. I see, yes, 1,080,000. I see it, yes.
Yep.
So
Expenditures, okay.
we go ahead and we refinance that. And we have a year when we refinanced it that we don't make a payment on that loan.
No,
And then in the following years, we end up with our levy going up because then we're making payments on the refinanced loan plus on the new debt. If we were to put money in the budget to make that payment like we always have, would that keep that levy from ballooning in the debt service?
I'm not seeing where we don't have payments. Let me put it this way, Chairman Bartlett. We did not restructure the bonds to not have a principal payment in a year. The main restructuring was to refinance to lower the interest costs. So if I'm following what you're asking, none of these were restructured with the point where we skipped a year of making principal and interest payments.
Well, why when I'm looking at the revenue for taxes to pay the community services building, that bond, it's zero for this year.
Okay, if you're looking at the 2013A, there's no revenue for the last year or this year is $1,080,000. But if you look down the expenditure side for 2013A, that same bond, there's no expenditures, there's no revenues, no expenditures. What's confusing is there's a 2013B, there's 180,000 in revenue there. That's the taxable bond that was issued that year. There was a taxable and a non-taxable. Only the tax exempt or the 2013A was refinanced. So I believe that's maybe where it gets confusing scrolling through these. You balance out between those two. So there's no delay, or maybe if I'm understanding where you're going with this, there's no pushing back, creating a balloon because of any of this refinancing or anything.
Well, why don't we show that we're paying something on the 2013A then?
There is nothing to pay there. That's been refinanced. Okay, let me restate that then. That goes down to the 2021A. That's all built in. That's where the principal and interest now resides.
Okay, so we're still paying it, it's just in a different one.
That's
Correct.
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 Thank you.
I didn't track with you right away, but yeah, that's what happens when you refinance like the 2013A and that 2018 bank loan. Those loans are closed out as of basically today. That future payments go down into the 2021.
All right. Thank you.
You bet.
Any other questions? If not, back to you, Mr. Chairman.
Thank you, Mr. Miller. At this point, we could use a motion to move forward and accept the debt service budget.
Also move.
Okay, Chairman Bartlett moves.
Second.
John Supervisor Calabrese, the seconds. Any other questions? Hearing none. All in favor, please say aye.
Aye.
Aye. Any opposed? Okay, move forward into health insurance. This will be our 2022 budget for employee health insurance.
Okay, I think I've got it. Do I have it, Heather?
Looks like it.
Okay, good. Okay, so on the revenue sides, the one that we zero in on immediately is this $1 million transfer from the workers' compensation fund. Heather.
That was brought forward a couple of months ago as a way to replenish the fund balance and help pay for the costs of Reform Medicine, the near-site clinic. The workers' comp fund was high, and so CFO Stry asked us to kind of look into that to see what that balance should be at. Since health insurance was low, we did that transfer.
Everybody recall that that discussion? Our worker comp fund was healthier than it needed to be, whereas our health insurance fund was being depleted through high usage, and we made the decision to make this transfer in order to bolster the one. Any questions on any of the other revenue parts of? I see we have a reduction on the stop loss of about 30%. Heather, any?
If I could hand that over to Patty.
Is Patty still awake?
I don't know.
Yes, I'm awake.
Oh, good.
Oh, I got to go to the other screen. Sorry, I'm looking in the wrong spot. Oh, well. So basically, we have not had as many individuals hit what we call our stop loss maximum. So we're not receiving in as much, but we're also not paying as much out.
Okay.
So we're looking at lowering that just because the last couple of years we have not received that much back in.
So it's based on recent actuals is the adjustment.
Yes.
Okay, thank you. Any questions on the revenue side of health insurance? If not, going down to the expense side, Heather, the increase, you've got the note there on reform medicine, 435,000. Anything you want to add to that conversation?
No, we just definitely budgeted for the incoming year.
No, I really don't want to talk about it. Thank you.
We can. I love the near site clinic concept. So.
And then we also see the increase 12% from the prescription. And
so
go ahead.
Yeah, look, currently we're using MedRx, and so based on the utilization data that we had at the point in time that we put this together, we're seeing an increase.
And but that will be revised based on using the different prescription, right? Or not?
Without any claims or historical data at the new rates, I guess I'll take Keith's advice on that, but I feel like it's premature.
Okay.
Yeah, I would recommend leaving it as is because it is very sensitive to actual utilization.
And just keep our fingers crossed that it will be less.
Right.
Okay. And then the health insurance miscellaneous line item. It's rare that we get to see a 28,333% increase, but it's $340,000 HSA contributions that we're expecting to make. What number, Heather, do you know what number of employees we're basing that on, or families?
Patty, do you remember? It's point in time data. I can't remember.
Let me see if I can find the file. One moment.
Well, she's looking
about
for that.
90-ish enrollees, but
Mr. Chair, while she's looking for that information, is there a line item to replenish the fund? Or do we just hope that the revenue is more than expenses?
Mr. Chairman, I can add to that in response. That in essence is what that $1 million transfer up in the revenues is from. That was the dual purpose when we talked about a couple months ago about reform medicine, the HSA contribution, as well as this. When we did our analysis and Patty reached out to our work comp folks, our insurance folks about that, and got recommendations on how much we really need to have. That's all part of that $1 million. So depending on actuals, as it sits right now, if all these numbers came out exactly as they are now, there still would be an improvement of over $200,000 to the fund. It's getting us in that ballpark of where we need to be. We're right at the minimum. And since we've put this budget together, the fiscal year end results for 2020 came in where that health fund basically stayed flat. So hopefully we flattened the curve and now we're heading it in the right direction. There might be the potential in future years to transfer more over from the work comp because we were being very cautious on it. Patty, I don't know if you remember, but correct me if I'm wrong, but I think we were almost 3 to 4 times the amount of money that we need in that work comp fund. But we could, in good conscience, come to you and suggest even going to the approach of taking all of that and moving it over. So this was kind of a first step, and we can see where it goes in the future.
I guess my concern is we were at 3 million not too many years ago, 3 years ago or so in that fund. We're down to around $1 million. We're going to transfer $1 million in. I was just wondering if we had something built in to try to replenish it back up to 3 million where we're a lot safer numbers. But
yeah, and
we evidently don't.
To be honest with you, Mr. Chairman, that is somewhat what's left in the work comp fund. You always have that opportunity to do a budget adjustment if utilization really is bad next year, or the utilization really goes south the balance of this year. so far, the current trends, my last update was we're doing fine. But you have that ability. So, yeah, it's certainly something that was factored into the conversation.
And I have a question here for Heather. Heather, when we set up went ahead and decided to do this move and set up the your site clinic, what were our anticipated hopeful savings per year that would then obviously build that approximately $1 million fund up? You remember?
I don't, and I don't know if I brought that file home. I don't see Patty. Patty's a ghost. I want to say it was around that $700,000 mark. I can pull up that previous report quick.
And that obviously would just remain in the fund then if we,
yep.
If this works as we hope it'll work.
May.
I found your April 28th report, Heather. That's the one you're looking for.
Yes, my computer's still thinking. If you have the number in front of you.
I do. For the first year, the potential saving is $456,898.
And so if we stay flat, we could hope to see something like $1.4 million, $1.5 million in there at the end of the year.
Right.
With cross our fingers and
the creek don't rise.
there you go. Thank you. Thanks for you guys looking that up for us. Any other questions or concerns then about where we're going with the budget for on health insurance? Okay, hearing none. Are we ready to make a motion, move this forward to the executive committee for their consideration?
I'll move the health insurance budget forward.
Thank you, Supervisor Trick. Anyone care to second?
I'll second.
Okay, seconded by Supervisor Sheila Story. Any other questions or concerns? Seeing none, all in favor of moving the health insurance budget forward, signify by saying aye.
Aye.
Aye. Any opposed? Thank you all. And our last budgetary item here is workers' compensation insurance.
Okay, I have called up the workers' comp, and that means that I have exhausted my expertise, and we'll turn it over to Heather and Keith for any highlights on this. I do see a drop, just a little bit of a drop in the premiums, but otherwise it looks very stable. There is the fund balance applied of $1 million. To workers' comp. Keith, anything else to address on this?
No, not from my perspective. I know Patty works much closer with this program. Was there anything of note here, Patty? I think we did pretty much look at this largely as status quo.
Yep, no, nothing significant.
Are there any other questions from the committee? That would do it for presentations, Mr. Chair. It ends with a whimper.
Thank you very much. Anyone care to approve moving the workers' compensation budget forward? I would so myself be glad to make that motion. Is there a second?
Supervisor Calabrese had his hands up.
Okay, Supervisor Calabrese, I'm sorry I missed your wave there. Thank you very much, John. So seconded by John Calabrese. All those in favor of moving workers' compensation forward, please signal by saying aye.
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 Aye. Opposed?
Call from
Leave us hanging.
Okay, I'm back on here, got rid of that phone call. Okay, that passes. Next on our agenda is review of the vouchers. Did anyone have any concerns or questions about the vouchers as they were printed and sent out to you via email? Supervisor Tripp, please go ahead.
I have to bring them up on my screen here. But I had a number of tactical questions. Excuse me while I continue searching. Oh, no. There was on the first page of the report, risk management, there was a claim for several $1,000s on property claims at Miller Auto Body. I'm going to assume that was for some sort of a vehicle repair, probably paint job or something. It was a little unusual, which is why I noticed it.
I would assume that that's correct. Unfortunately, Patty's dropped off. Otherwise, she'd be able to answer that. We can get you an answer if you want confirmation on that, but that would be
No,
or
that's fine.
okay.
My next question is from the treasurer's office. We have taxes, a penalty for late taxes paid to the town of Springbrook for $1,269. And that struck me as being unusual. I just wondered if we could get some sort of commentary on that.
Yes, give me 1 second. I'm getting to the report.
Sure.
Okay, I found it. Give me 1 second. I actually am guessing that, so when we have an ag conversion, and I know that there have been several for Springbrook recently, 50% of it goes back to the village or township, and we keep the other 50%. So if I had to just quickly look, that is what I would say it is. And actually, while we're on here, I can just look through that folder and double check.
Great, thank you.
And I can add to that, Supervisor Tripp. Yeah, the statutes have very specific requirements as far as what they call illegal taxes or tax adjustments like that. The terminology as defined by the state statutes are kind of daunting when you look at them. But yes, there are specific required payments that come either into the treasurer's office or paid out to other communities.
Okay, that answers my question. Thank you. And my third question is.
Oh, I'm back. I just wanted to let you know that I am looking at that folder. That's exactly what happened. We had someone who had several different parcels that were an ag conversion. So half of that money has to go back to the village of Springbrook.
Okay, thank you so much.
Of course.
My last question is about the guardian ad litem fees that are paid to the Christina Meyer Law Firm. And this isn't a finance question at all. It's, if I'm not mistaken, she is now a circuit court judge.
Yes.
I'm going to assume that there's an appropriate answer to this because otherwise we're looking at some trouble. But don't we have some guidance and and county ordinance about employees of the county. Of course, she's a state employee. Anyway, it just seems unusual that a county court, a circuit court judge is in a law firm that's collecting a fair amount of money from the courts.
She's not in that law firm anymore. I mean, I don't know what stage she's in, but she certainly has to be winding it down. This would be payments for her work as a guardian ad litem prior to taking the bench.
Yeah, okay, I knew there had to be an answer. Is there still a Christine M. Meyer law firm?
I guess there would be, but I guess if it was me, I would probably have a law firm yet with that name, and it would be a post office box for collecting final payments that were due to the firm, and it wouldn't be engaged in any ongoing or future activity, and I think you can expect to not see this item on, except to the extent that it's reimbursement for work that has already been done and completed. And if it isn't completed, it would have been transferred to another attorney.
Thank you, Nick. I should have thought of that myself. This is obviously for work she did before she became a judge. So
yeah, It's only been a couple of weeks.
Yep. All right. I should have realized that. I apologize for my.
I'll make a motion to pay the vouchers. Or to accept the vouchers.
A second.
You are muted, Mr. Chairman. Vaughn, you're muted. There you are.
I didn't mean to click on that. Motion was made by Chairman Bartlett and seconded by Supervisor Calabrese to accept the vouchers, and all the questions apparently were answered. All those in favor say aye.
Aye.
Aye. Any opposed? Thank you all. I'm sorry about that. My finger got in the way there. Because any consideration of reports, resolutions, or ordinances to the county from the committee, there are none this month. Resources, employment law issue is the next one up, and we are gonna, at this point, I'm gonna ask for a motion to go into closed session. Chairman Bartlett so moved. Is there a second? Seconded by Supervisor Story. This is a roll call vote that is needed.
I can call the roll if you'd like.
Okay. Supervisor John Calabrese.
Yes.
Chairman and Supervisor David Bartlett.
Yes.
Supervisor Sheila Story.
Yes.
Supervisor James Tripp.
Yes.
And myself, yes. Okay, that is unanimous. We will be going into closed session.
Mr. Chair, what I recommend is that with the exception of myself, Keith Stray, Heather Murray, Nick Lang, Chris Corpola, that we invite, and of course the committee members, we invite the others to depart. Matt from IT needs to stay on with us to run the IT portion, but he will stop the recording and he will stop the live stream.